Doctor, is it audible?
Yes.
Okay. So, a very warm good evening to all of you. Myself, Dr. Rishmi VS, on behalf of Ayurveda Map, I'm inviting all of you for today's session, especially our respected faculty, Dr. Kirathamoorthy sir, all the participants, and the members of Ayurveda Hospital Management Association. We are very glad to be here as we are introducing our new venture, that is the professional diploma course in Ayurveda Panchakarma. And also today we have the introductory section related to the course. And before moving to the main session, I would like to brief about the Ayurveda map and its activities. About Ayurveda map, Dr. Jasul Alingal is the founder of Ayurveda map and started the working in the year 2016 with the aim to upgrade the skill of Ayurveda professionals. And by the year 2017 is officially inaugurated by Dr. P.M. Warrier, the managing trustee of Ayurvedishala, Kottakkal, and started in-hand practical sessions. And we got very warm responses from all the participants. And during the COVID pandemic situations, we have shifted the offline sessions into an online manner. So these are some of our online sessions, as all you know. And also, then we have started a postgraduate diploma course in Ayurveda cosmetology and then postgraduate diploma course in Ayurveda nutrition. And also during the pandemic situation, intended to give an exam-oriented tuitions for Ayurveda UGs and PGs, we have started Swadhyaya sessions. And moving on to this photograph, this is in connection with the offline workshop of our postgraduate diploma course in Ayurveda cosmetology, and is the valedictory ceremony of our first batch of Ayurveda cosmetology diploma course. And the first batch of students were successfully completed the course a few weeks back. And we wish all the very best for the bright future. So here we are introducing our new course, that is professional diploma in Ayurveda Panchakarma. This is also a 1-year duration course and will be starting on 27th February 2023. And these are the syllabus outline we will be held during that course. That is Introduction to Panchakarma, Concept of Riddhi Shodhana and Kriya Kala, OP department level Panchakarma, and the principles and practice of all Purva Karmas, Pradhana Karmas, and Panchakarma, and also Keraliya Panchakarma and regs and formulations in Panchakarma, and applications of Panchakarma in different branches of Ayurveda, and also about Shara, Agni Karma, and the physical therapies. The main attraction of our new course that we are offering both offline and online sessions. The theory sections will be held in an online manner, and offline sessions will be there exclusively for practical sessions, and that will be held in an NABH accredited Ayurveda hospitals in Kottakkal, Kerala. And there will be having an orientation course regarding the details of our new course, and that will be on tomorrow 8 p.m. and all are invited for the same. So for the more details and registration of our professional diploma in Ayurveda Panchakarma course, you may contact Dr. Jasul. So today we have an introductory session on the topic Basic Principles in Ayurveda Panchakarma. It will be dealt by Dr. Kirathamoorthy sir. Professor and HOD, Department of Panchakarma. Before moving to that, we from the group of Ayurveda MAP, we wish all the very best on the 16th annual general body meeting of Ayurveda Hospital Management Association, which will be going to done in Palakkad at 26 February 2023. So about our respected faculty, Professor Dr. Kirathamoorthy sir is now working as the HOD and Professor of Department of Panchakarma, Vishnu Ayurveda College, Palakkad. He is having a teaching experience of long 37 years and started career as lecturer in Ayurveda College, Coimbatore, and retired as Professor and HOD from Department of Samhita and Siddhanta, VPSU Ayurveda College, Kottakkal. So these are some administrative positions held by him, like the chairman of Central Council of Indian Medicine Syllabus Reform Committee of Padartha Vignan, New Delhi. And also, he is holder of Dr. APJ Abdul Kalam Lifetime Achievement National Award by International Institute for Social and Economic Reforms, Bangalore. And he has published various articles in national, international journals and in dailies, and also presented more paper presentations in international seminars, and also graded and co-graded many of the theses for PG students. So I welcome you, sir, for your today's presentation.
Am I audible?
Yes, sir. So audible.
Shall I start the session?
Yes, sir. Yes. Please.
Is the slides visible?
Yes, sir. Yes.
Okay.
Yes.
A warm welcome to all of the delegates who are attending this session. And I'm very thankful for the management of this session, Dr. Jasul and Dr. Rashmi. I'm very thankful to you. And I started my career with the basic principles and then ended with Panchakarma. So the session also is like that. It covers the basic principles of Panchakarma. Shall I go directly to the session? We shall see. The application of basic principles in Panchakarma is the topic. So whenever a topic is concerned, we have to think about what is the importance of this basic principles in Panchakarma. And Charaka has very well explained about the basic principles related with Panchakarma. He says, Panchakarma, there are indications and contraindications. And he says, Yasyam karyam akaryam syat. In some of the areas where Panchakarma is contraindicated, we can do it with special remedies and in special conditions. So we cannot follow the text only. We should have a practical application of the text. Na shastra matra sharana, na cha analogitagama. Just the knowledge of text will not be suitable for doing Panchakarma. We have to have the practical application level expertise. That's what we say hands-on training. So this is very much dependent upon the basic principles what we have studied. So whenever Panchakarma thought is there, we have to think about what is Panchakarma and where it is applied and why it is applied and how it is applied, and we have to see how the Rasayana can be done for a case. We know there is a treatment protocol in everything. Even every chapters of Chikitsasthana covers a protocol. It deals with a protocol. It starts with the Deepanapajana, then it moves into the preoperative procedures of Panchakarma, operative procedures of Panchakarma, and post-operative session of Panchakarma. And last, every chapter tells about Rasayana portion. This is just like there is a Malayalam book called Manushya Shariram that covers about the anatomy and physiology of body. The anatomy and physiology of the body is just like a machine only, and with a consciousness. So he says in the author tells, it is just like a machine. Every machine, and Charaga, Sushruta, Vagbhada, everybody tells that. He tells about body as a Ratha. Ratha or car, as such we are telling now, car needs a service. Every 10,000 kilometers, car is to be serviced. Because Acharya tells about that also, Kramat apange bimano pango vashyam bhavatyada. When we are running the vehicle, there will be carbon deposit, etc. in the vehicle. So like that, whenever our body is working for years, there will be malinya in the body. Kramat apange bimano. In the jewel itself, there will be powder on the top of the jewel. So we have to clean it. So like that, body also gets malinya, mala, increased in the body, and toxicity will be developed in the body, so that we have to clean in the some of the time when it is recommended. So for vehicle, they say 10,000 kilometers, and according to Ayurveda, we say Sidodbhavam doshachayam vasante vishodhayan grishmajam apragale dhanatyaye varshikamashu samyak prapnodi rogan rudujan najadu. Sidodbhavam doshachayam vasante. Kapha is does the accumulation in the Shitakala, so it has to be purified in the Vasantakala. And Pitta, Vishodhayan Grishmajam Abhragare. Vata should be purified, clean, Abhragala, in the starting of Varshakala. which is accumulated in the Grishma Kala. Dhanatye Varshigamashu Sadhu. Pitta will be increased in the Varsha Kala. It has to be purified in the Dhanatye Varshigamashu Sadhu. Dhanatye Sarat Kala. It has to be purified. So this is the process of cleaning the body and keeping the health of the body. So it has got a preventive aspect and also a curative aspect. Curative aspect is according to that when diseases occur, we have to see the conditions and do Panchakarma. So in that cases, we have to see many of the conditions. You have, a physician should have yukti. What is yukti? Yukti is Bahukarana Yogaja. There are 100 conditions. We have to find out these conditions and accordingly the treatment procedure, treatment time, everything changes. So that is why he says, Acharya tells Ashtanga Hridayakara, Avahita Manaso Yathaswam. We have to see Shraddhavan. Avahita Manasa means Shraddhavan. We have to be very careful in dealing with the disease conditions. So the Acharya tells, I am telling about many of the conditions which come across in your treatment protocol, treatment expertise. There are some other conditions I cannot tell because it is Sahasra, Bahukarana. There are innumerable conditions and we have to ourselves find out and accordingly we have to treat. So Yukri should be there whenever we go for Panchakarma. There is no need of Panchakarma in some of the cases where we need not do Panchakarma. Langhana, Deepana Patana, Langhanam, Patanam. Langhana, Langhana Patana, and Dosha Vasechana. When too much doshas are accumulated, we have to purify it. If the doshas or malas are very less, we can do Langhana and purify it. And if it is Madhya, we can adapt the Langhana and Patana. And when it is too much, we have to purify it. And there the Panchakarma role comes. So in that conditions, we have to adapt Panchakarma only to remove the accumulated, too much accumulated doshas. And he tells about when there is a water in front of your house, when it is very less, you can, in the sunlight itself, it will be removed. It will become dry. When it is some more, when it is there, water is there, we have to adapt. We have to put sand or something. If the water is too much, you have to pour it out. That is that pouring out of doshas or malinyas or waste material from and toxic materials from the body, and this cleaning process is called Panchakarma. So this is what the Panchakarma role comes. I told you what is Panchakarma, where it should be adapted, and why it is adapted, and how it should be adapted. We are dealing exhaustively in this class. We shall go to that. Okay. So every Panchakarma procedure, it is depending upon Tridosha. Tridosha is the basic factor for every disease. A theory to explain all possible phenomena of the living organism is called as, that is grouped into three doshas, three vital factors. That is Vata, Pitta, and. So based on fundamental nature of natural observations, which are unchangeable. This is unchangeable. There is no change at all. The Tridosha was there before, now also it will be there, and it is anadi. Soyama anaditva swabhava samsiddha lakshanatad. It is always there, and we have to find out every human being is made up of three doshas, and this principle is always existing, and we have to see the three doshas only when we are going to for Ayurvedic treatment. So this biological dynamics not necessarily follow physical dynamics. You can have physical dynamics in the modern medicine, but somewhere it will be same as in the Ayurveda also. But this biological dynamics of Vata Pitta Kapha will not be always go in par with the modern medicine. So we have to stick on to our basic principles. Then only we can attain the successful treatment also. So we shall see the dosha definition not in terms of structure, but in qualities and activities. So guna and karma are taken into account while we are thinking of three doshas. And they are assessed by guna and karma only. Dravya is having guna and karma, and we are treating according to the guna and karma. We are identifying the dravya of Vata Pitta Kapha. How Vata Pitta Kapha can be identified? By guna, by properties and action. So properties and action denote which dosha, Vata, Pitta or Kapha has been deranged, and how it increased or it decreased. That things we can identify. So for guna, main basis to apply Samanya Vishesha Siddhanta. So what we are doing is the application of Samanya Vishesha. When it is decreased, we have to increase it and maintain this homeostasis or optimum level. When it is increased, we have to apply Vishesha Siddhanta and decrease it and keep the doshas in. And the optimum level of doshas are the health. Samadosha, Samadnischa, Samadhadhumalakriya, Prasannatmendriya Manaha, Swasthaitya Vidiyade. There, everything covers, every principles are covered in one shloka itself. So we are finding out the cause and cause-effect relation between guna and karma, understood distinctively as dormant qualities and dominant qualities. The dominant qualities are called virya, and dormant qualities are called as just guna. So this is a biological mass of dravya, and it has got doshas are biological mass, and it is maintained. Maintainer is Ushna Snigdha Guna and Shita Ruksha. Shita Ruksha is the body character, and whenever there is a change in the Shita Ruksha, Shita Snigdha quality is the body, and whenever there is a derangement, there will be Rukshada. In Snigdha portion may be decreased, or this Snigdha portion may be decreased, or Ushna portion will be increased. So like that, the disease may be manifest in this, mainly the two qualities, that is Ushna, Snigdha and Shita. So any body part is, when it is deranged, we have to keep it in the optimum level. So it is, the Panchakarma is according to guna dependent and also sthana dependent and dhatu dependent and kala dependent and karma dependent. So whenever we do a vamana karma, it will be according to guna dependent. We say in kapha, vamana is advocate. And it is in sthana dependent also. Vamana does the purification of the upper portion of the body through the mouth. So it is sthana dependent. And Nasya also, when there is our disorders in the shiras, it is sthana dependent. And dhatu dependent also. Some of the dhadus, rakta dhatu, we have to purify it by virechana. So it is according to dhatu, ashraya, ashraya bandha. For pitta, it is the treatment is virechana, and rakta dhatu is the ashraya of pitta. So kala dependent also, according to in Vasanta Kala, we have kapha will be increased and we have to do vamana. And karma dependent also, it depends upon the karma what we are doing. Okay. So guna dependent treatment is there, and also karma dependent treatment also is there. Vada is Ushna to Sanchaya occurs by the Vada dosha. That's the Sanchaya by Ushna Rucha, and Pragopa is by Shita Rucha, and Samana by Ushna Snigdha. This happens in the according to the Ritus. In Grishma, Ushna Rucha increases, and we call Ushna and Rucha increases, and the Sanchaya of the Vata occurs. And when there is a Shita condition occurring in the Varsha, it becomes Pragopa, and Shamana occurs by Ushna Snigdha. So these are the things you have studied it. So Pitta also, Shita Tichna gunas make Sanchaya, and Ushna Tichna becomes Pragopa, and Shita Manda it decreases. Like in Sharat Ritu, the Shita Manda Pitta gets aggravated, and next Ritu, Sharad Ritu Pitta increases due to the Ushna Tichna guna. Hemanta, Shita Manda qualities increase and Shamana occurs. And also Kapha, there is Shita, by that we have to understand that Shita Snigdha qualities in Sanchaya of the Kapha occurs, and by Ushna only, Ushna Guna and Snigdha Guna only, Pragopa occurs. That is different from the other Vada and Pitta. You know, when Kapha becomes being Vilayana Rupa, then only Vritti occurs. For Vilayana, there should be Ushna Guna. So that is why in Vasanta only, due to the Ushna Guna only, this Kapha Sanchita becomes Vilayana and diseases occur. And Ushna Rucha Gunas decrease the Kapha. So these qualities are taken into account when we are doing the treatment. So we shall go into detail of it. Snigdhobhashaya is Vada and Vata Pitta, and Ruchobhashaya in Kapha and Kapha Pitta. So when we are advocating treatment, we have to think in the way of doshas, how it has been increased, and which dosha has been increased, which guna has been increased in that condition. Accordingly, we have to advocate the treatment, prescribe the treatment. So Ayurveda speaks of human body, dosha, dhatu, and mana. I need not explain it. And based on directed or influence factors over this, dravya, guna, and karma. Different dravya with their inherent guna impart multiple action over the body. So different dravya with their inherent guna impart multiple action in the body. Not only one action, there are multiple actions for guna and also karma in the body. So dravya having virejana property induces purgation. Then what is special when it is done as a Panchakarma? In purgation, only mala is cleared. Correction of dhatu and dosha is not occurring. So we used to give virejana sometimes, but we are not going for snehana and swedana, means it purifies the mala only. There will be purgation, but mala only will be eliminated from the body. While we are doing snehana and swedana, all the body orifices, the mala and also doshas and dhadus, everything vitiated, and they will be coming into the koshta and get relieved. So when you are giving without this preoperative procedures, it will be only eliminating the mala only, while in according to the way which, according to the Panchakarma procedure, Snehana and Swedana is done, the body fully, from the nook and corner of the body, there through the orifices, through these srotases, all the purification takes place and body fully purifies. That is the difference between a purgation and also a virechana done according to the Ayurvedic way. So different pathologies are there: ama, doshakopa, dhatu dushti, malasanchaya, etc. Each will affect any of the srotas, or koshta mediates in our process. Agni too does the same. So when we deal with Panchakarma, there will be effect in the srotas. Koshta mediates all the process, and Agni too does the same. So Panchakarma describes how to achieve the clarity of entire human body at the micro level by means of rightful administration. So the key terms cover in Panchakarma are Srotas, Koshta, and Agni. So Agni and Koshta are the main dominant places where this Panchakarma action is there. Quality dominant in one site or situation may be dormant in another site or situation. Like Agni, when we take Agni, Vishamagni due to Chala, Anavasthitatva, and this Chala guna, when the in Pitta, Tichna due to Ushna Tichna guna, and in Kapha, Manda due to Guru Manda guna. While in Koshta, in Agni, Vishama Agni, it is Vishamagni, while Vada activates the Koshta as Ruksha Sita gunas to Krura Koshta. And in Pitta, in the though the same gunas, Ushvatiksha gunas are increased, it will lead to Mridu guna in the Koshta. And in Kapha's Guru Manda guna leads to Koshta as Madhyama Koshta. There is no role of Guru Manda guna in the Koshta. That is why it is Madhyama Koshta, and it is Shita Snigdha gunas. So in different areas, these gunas action differ. So Panchakarma, how many Panchakarmas are there? Though Samhitas, Sushruta Samhita, Charaka Samhita, and also Ashtanga Hridaya, Ashtanga Sangraha, they don't tell it as Panchakarma. Panchakarma, the word comes only in Bhava Prakasha and also Vaishantya Ratnavali. In other areas, though Panchakarmas are described, like in Charaka, Apamarga, Tanduliya, etc., he deals about the Dravyas and their Shodhana, does the karmas, Shodhana karma, it does. But in Ashtanga Hridaya also, he tells them it is Shodhana, not as Panchakarma. And in Bhava Prakasha, he gives the correct definition. What are the Panchakarmas? He says, Vamanam Rechanam Nasyam, Niruhascha Anuvasanam, Etani Panchakarmani, Kathitani Munishwari. He says, Panchakarmas are these: Vamanam, Rechanam, Nasyam, Niruhascha, Anuvasanam. He doesn't cover Raktamoksha in that. While in Sushruta, he adds this Raktamoksha as Panchakarma. So 5 karmas are called as Pancha. Pancha is 5, and karma is deeds or karmas or actions. So which 5? Why? This question arises. For Dhanvantari Sampradaya, it is Raktamoksha, and in Charaka Atreya Sampradaya, it is Anuvasana. So when we deal about Anuvasana does not purify too much, that is why it is not considered as Panchakarma according to some of the Vyakhyakas or Delhana says about like. So which why we can include, so we can include Raktamoksha also, because Rakta is also considered as Chaturtha doshas. So two schools, Atraya and Dhanvantari, divided opinion of Anuvasanavasti and Raktamoksha. So does the word mean 5 therapies alone? Pancha, not only that, Pancha is considered as Vistararthe, elaborate, detailed procedure. Like that also it is told. So Langhana, Brahmana, there are 2 Divitha Upakramas. In this Divitha Upakramas, Divithopraniya Adhyaya, he tells about Panchakarmas. And Langhana, the Shodhana Karmas, Vamana Virechana Vasti Nasya Raktamoksha comes in Langhana. So these are the okay. And we cannot fully tell that like that. All Vamana, Virejana, Vasti, Nasya, etc. all are Langhana like that. We cannot. There are some Brahmana Nasyas told in the classics. That also, when that's an exceptional thing, it purifies and also it does the Brahmana also. And Vasti, there are Brahmana Vastis with Kshira, etc. told. So we cannot tell fully these Panchakarmas are, all Panchakarmas are Langhana, we cannot tell. Some of them gives the portion of the body also. Like Snehanas, like Anuvasana Vasti, Matra Vasti, they are Snehana, and also with the usage of some of the Tailas or Ghritas, it becomes Brahmana also. So there are generalization and exception, and exceptions cannot be generalized. So we have to find out there is exceptions. So Panchakarma, Vamanam Rechanam Nasyam, Niruham Anuvasanam, Edani Panchakarmani, Kathitani Vishre. I have already explained it. Not a final statement that we have to consider. Still limited to 5 because they meet these criteria. That is why they are considered like that. There are only 5 procedures which purifies the body. So, iha vamanadishu karma lakshanam bahuvidi kartavyada yogi dosha nirharana shakti tyajyatva jayastu. These 5 karmas bahu kartavyada. It purifies the doshas fully in a maximum quantity. When there is too much vitiation of the doshas, too much vitiation of the malas, they are purified by Panchakarmas. So that is why it meets the Shodhana karma and they are considered as Panchakarmas. There are many procedures which gives only very less elimination of the doshas and they are not considered as Panchakarma. Require extensive management and also have pronounced potency in elimination. So Shodhana karma, aimed at Shodhana karma, correction of pathology, dosha avastha, dosha gati, and also srotas are to be considered. So we say that disease occurs by the dosha dushya samurchana. Dosha iti kartavyata ko yogolpadaka hetur nidanam, he says. Dosha, by the nidanas, they vitiate, and when they are vitiated in the koshta, it goes to all the cells of the body, and that is called as dosha dushya samurchana. The tissues are vitiated, and when this dosha dushya samurchana occurs, we have to clear these doshas from the body fully from the body, that is done by Shodhana Karma only, and it is called as Panchakarma. So, Mulad Unmulayen Malan, it clears this root level. In the root level, it clears the dosha dushti. So that is why it is very much important. So Shodhana Karma dosha avastha should be taken into account. Prabhuta, Madhya Alpa, I have already Prabhute Shodhanam Tadhi Mulat Unmulayen Malan. Doshavasaitanam it is called. Okay. So when these doshas are Leena means it is it goes into the cellular level and sticks into the tissues, sticks into the cells. In such conditions, it is not easy to be detached. So for that, for detachment of these doshas from the cells or the tissues, Snehasveda Krama is needed. Snehasveder te dravigritya koshtam nita sammik shuddhi bermuhi. Sneha Sweda. Sneha means oily nature, and Svedana means giving heat into the body. So it becomes Vilayana Rupa or liquefies the doshas, and when liquefied, it comes to the Amashya, and it is easy to get eliminated by Vamana or Virechana. Okay. So role of Pachana, Snehasveda are the Purva Karma's preparatory procedure. Shodhana Karma, Doshagati, Poshtagamana, movement of the morbid elements for getting eliminated, and then role of Pachana, Snehasveda in inducing Gati, and Leenatva Parityaga case. So it comes out of the cells and gets purified post-gamana. Vyayamat Ushmanastaikshat Ahitacharanadavi Posthas Shakhasthi Marmani Dutatwan Marudasya Dosha Dosoto Mukhabishodhanat Prithyavishandanat Pagat Postam Vayosta Nigrahat. So these are the 4 factors by which it comes into Koshta. When it becomes liquefied, it comes into the Amashya. So Koshtagamana and result in Upasthitatva or ready to get eliminated. And Charaka tells Chaudjamasanjan Anupravana Bhavat, like that in Vamana chapter, he explains how this is like a pot in the Koshta. Instead of in Upama, he gives Koshta synonym as a pot which is pasted with the oil. Then the things can be easily eliminated. So like that, when Snehana is done, Svedana is done, Koshta becomes oily in nature, and when doshas comes from the body, it easily gets detached and it can be purified. So Upasthita Marga, it should be eliminated. So Koshta, Mahasodas, Soda Samudaya, purification by transdermal and membranous purification occurs. Divitham hi bheshajam anda parimarjanam behi parimarjanam cha. Divitham hi bheshajam anda parimarjanam. Purifying in internal orifices and behi parimarjanam, the external orifices. Both are done in Snehana and Svedana. So, transmer behi parimarjanam and abhyanga sharira parimarjana, these are transdermal, and upakrama, kriyakrama, lead therapies also eliminate doshas. So, Panchakarma term credited to just 5 as Edibeha Vamanadishu Panchakarmasu Pankaja Shabdabad Yogaruteyam Samya. Yogaruthi means Pankaja. The example is Pankaja. Pankaja, from the mud only this lotus comes. It is so Pankat Jadam Pankaja. From the mud only lotus comes, so it is called as Pankaja. And there are many other things which comes from the mud, and blossoms also. Many plants are like that, it gives flowers, but they are not considered as Pankaja. So Pankaja Shabda, it is Yoga Rudhi. From the word meaning, from the word Ulpatti, we can know the meaning, and also Rudhi means when we so like we say cat, there is no like that we cannot etymology from the etymological or derivation of the word we cannot tell why it is called as cat. Like Pankaja, it is a duty also. From the ancestors, they tell it is as Pankaja. So in Dvaya Sampya, in two ways also, Panchakarma is told as 5 karmas which are described here. So common presentation in our clinics. See, history of 1 month, there is a middle-aged man traveling, riding, and junk food, untimely and inconsistent appetite, bowel 1 per day. He gets low backache. What is our prescription? We can give Erenda Taila, we can give Rasa Saptagam Kashaya, or we can see Abhayarishtam, we can give Gulgulu, we can have massage and bandage with Murivanna. What is the logic or rationale behind it? Ruksha Bhauta. In Rukta Shobha, etc., Erenda Taila is the Prashasta drug. And Vadanulomana can be given, in Vadanulomana conditions, we can give Abhayarishta. And Janka Parva Shula, Rasna Saptaga is indicated. And analgesic and anti-inflammatory Gugulu can also be given. And as antispasmodic, Murivanna is antispasmodic. So has the logic done enough justice to the situation? No, it's not. It is not the way we have to think about how to increase the logic factor in our approach to diagnosis and treatment. We shall think over it. What are the effective tools available? Let us go back to the basic question. We have to think in this fashion only. We have to go into the basics. How this occurs. In this case, not a general thing. This patient, kim aharena kupito vayuhu. Whether this vada koba occurs due to ahara, kim viharena, or his travel, vihara, has it originated by that? Tatha, rutshena, root, is it due to the rutshaguna, lakhuna, lakhuguna, or shishirena? Sometimes it will be shidena, wa sahasena, sometimes with sahasa also it occurs, adventures, and vegarotha, obstruction of the bowels, or vegarotha, or bhayena, maybe due to bhaya, or shogena, vedi, tatascha, tat pradipaksham aushadam. So we have to give medicine according to prayujyamanam ashu siddhaye sampadyate. So we have to see, we should not give a prescription which we told before. We have to think about in which causative factor generates this disease. See, we have allergic disorders. We have to find out what are the allergic factors generally for in this condition. And we have to ask the patient which of these allergic factors he is taking in. So according to, we have to advise him to stop that allergic factor. So like that, when a IVDP case or some Jankha Parvasti Shula occurs, how it has been originated, that we have to think. Kim aharena kubido vayuhu, kim viharena, tatha rutshena, laghuna, shishirena va sahasena, vegarothena va bhayena, shokena vedi. Tatascha tat pratipaksham aushadam prayujyam. So we have just opposite. According to that, we have to give the medicines. This is what called Yukri. Yukri is Bahukarana Yogaja. There are innumerable factors. We have to find out the correct factor. See, I can tell you, a patient came with insomnia. So there may be many factors for insomnia. I asked the lady, what is the causative factor? What the mental problem she is having? And she will not tell it directly. And by taking much time, I had a rapport with the patient. So she was telling the causative factor of the problem, the haunting problem she has. And I just gave solution for that. And I need not give any sleeping medicine for her. She was having good sleep. I had counseling with the family members, and the problem was solved, and she was sleeping properly. This is what a patient needs from a doctor. Not only just prescribing the medicines, we have to find out what is the causative factor behind it, and nidana viparitam aushadam dadyat. We have to find the causative factor, accordingly relieve the nidana, the disease comes to subside. Whenever there is without there is nidana when solved also, when pain occurs, in such conditions only we need a medicine for that. Okay, so did we think about alpa, bahu, dosha, kopa, nidana and lakshana, kevala or samsarga, ama or nirama, bala, dosha, vyati, roga, guru laku vyati, necessity and feasibility of virejana, selection of aushadha as per rogamarga or sodas, correction of diet, physical and rehabilitation measures. These things we have to think about. Then only our treatment will be proper. So low backache situation 1, low backache history of 1 month, Vyathi Bala, middle age, traveling, riding, junk food, untimely, dosha Bala, Kaphayukta, Ama, Atura Bala, reduced appetite, bubble 1 per day. So Rasa Saptam with Shunti, Vaishwanara, Churna or Gandharvastadi Kashaya, Hinguajadi Churna, Rucha, Churna Pindasveda, or we can adapt Rucha according to the condition, or Chara, Vaitarana, Erenda Muladi, Lankhana Vasti, when we need a Lankhana, we have to adapt these things. If it is too much obese, etc., Erenda Muladi and the Chara, Vaitarana, Vasti will be effective. Otherwise, when there is Ruchada is increased, we can adapt to the Snigdha, Snehavasti also. So we have to think about it, what the case is. So Nirama, when Ama is there, these things are Nirama, Snigdha Sweda can be done, and Mathutailiga Brahmanavasti can be given, and Maharasa the Kashaya can be given. Low back situation, second complaints of low backache, history of 1 month, Vyathi Bala, middle age, traveling, untimely food, dosha, Bala, Vata is to more, Nirama and Adura Bala, proper appetite, bubble, normal, lean, built housewife. In such conditions, we have to Mritu Pachana. Pachana can be done, Samana Sneha can be done, Sahajaradi or Erenda Thailand can be given, Patra Bodala Sweda can be done, Shira or Vaidarana Vasti can be given, or Kadi Vasti can be given. These things we can adapt in the situation of low backache situation second. Okay, so it depends upon how you get the case and what are the gunas increased in the condition, what are the karmas which vitiate the disease. Deepana, Pachana and Rutshana. Snehasya Panat Purvam Datavyam Mridubheshajam. Deepanavachana should be given before the Snehapana, because to Sneha goes into the srotasas when Deepanapachana is given. Deepanapachana purifies the srotasas and Sneha can go inside. When there is a blocking in the srotasas, Sneha cannot go inside. So we have to purify the sodas first with Deepanapachana and liquefy the as a pilot vehicle, we have to give Deepanapachana, and from there, Sneha enters into the cells and tissues. So, Uttejanam Hutashasya Poshthalaghavakaarija. Uttejanam, Agni should be increased so that Ama will be digested. We have to give Pachana and Deepana. So, Langhana factors and useful treatments, Vikriti, Bala, Agni and Adura and Satya, Panchakola Churnam, Ashta Churnam, Vaishwanda Churnam can be given for Deepanapachana, Abhyarishtam, Takrapanam, Udavartanam, or Dhanyamla Dhara. If even Upavasa can be first adapted, then Deepanapachana can be done. And don't go behind Vyadhishamana. We have to see the causative factors first, and accordingly we have to correct it. Udavartanam, in case of prolonged repeated application, Snigdhata by using Madhura Snigdhadravya. In case of prolonged repeated application, Snigdhata by using Madhura Snigdhadravya. Dhanyamla Dhara can be done. So we have, in Udavartana cases, we have to give Anulomana of the Vada. Accordingly, Snigdha procedure can be adapted. Dhanyamla Dhara in case of prolonged repeated application. So, if Dhanyamla Dhara is done more, it will certainly give Rutshata. So, that we have to find out. To be supported as succeeded by proper Snehana. In such conditions, we have to give Snehana also after the Dhanyamla Dhara. So, Snehanam, Abhyantara and Bahya, Shodhana and Shamana and Brahmana can be adapted. Time, dose, duration, monitoring, endpoint should be found out, and accordingly we have to make it practical. Adura Bala Pariksha also should be done. Selection of patient as per contraindication. Contraindicated patients cannot be taken for Panchakarma. Snehana, Stula or Durbala, we have to find out. So, Adura Bala Pariksha also should be done. Selection of method, Rutshana Purva Snehana, Mamsala, Medura, etc. We have to do Rutshana first. Brahmana can be done in the cases of Klesha, Bhiru, etc. Sadhya Snehana in Parihara Asahishnu. Those who are not proper for, they cannot afford to do it. In such conditions, we have to give Sadhya Snehana also. Adura Bala Pariksha, selection of Aushatha should be there according to Adura Bala, Vasamajja in Kleshakshama, Taila in Sthula should be adapted. Dosha Bala Pariksha also, patient selection should be done according to Dosha Bala Pariksha. Method, Brahmana, in Alpadosha, when in Kapha, Ama, etc. Medicine, Taila can be given in Kaphavata conditions. So we have to find out the condition and accordingly we can prescribe the medicine. Shodhananga Sneha, time, dose, duration, monitoring, endpoint should be found out, and time before getting appetite. For Shodhananga Snehapana, it should be before getting it. Hyastane jirna evane snehocha shuddha evahu. Hyastane jirna evane. When the last day's or yesterday's food is digested properly and there is no there is more hunger in conditions. Before that, before getting appetite, we have to give Sneha Shodhananga Snehapana. Then only, otherwise, when we get the hunger and we give Snehana, it will be digested. So before getting hunger in the early morning, we have to give Snehapana so that it will be digested and it will be give Snehana for the body. Otherwise, it will be digested and proper Snehana cannot occur. That is it. Okay. So dose also do not fix the pattern earlier. We have to, according to conditions, we have to increase in order. We can have Snehana or accordingly condition we can change also. Monitor Deeptagni, Vada and Lomya, Klama, Udvega. When Klama and Udvega is there, we have to see the endpoint. Bahya Snehana, Apyanga, Dravya Vigalpa, Mardana, Sambhahana, etc. Apyanga, Bahya Snehana, Dravya Vigalpa, Mardana, Sambhahana, etc. can be done. Shirodhara can be done. Dravya Vigalpa, Kapha Vartha, Kapha Kshayakatva, height, thickness, temperature, speed, movements. These things we have to take into account while we are doing Shirodhara. Since Shirovasti, Nasya Purvagatva, Paschat Nasya Arhatva. Shirovasti, Nasya Purvagatva. Now, before Nasya, we have to do it. And Paschat Nasya also, Shirovasti can be better in which condition will be suitable, we have to fix. So, use of Mardana and Sambhahana, etc., clinical appreciation of pain, tenderness, and swelling, etc. We can have use of Sambhahana and evaluate structural deformities. Accordingly, we have to think in such, then when there is too much pain, we should not do Mardana. Tenderness. When tenderness is there, you should not apply too much pressure. Application of pressure with gradations, gentle, moderate, so traction can be done. Kadi Jankori Bhagnanam Kavada Shayanam Hiram. Immobilization should be advocated in the cases of IBDP cases, some of the cases, and that also we have to find out. Well-directed strokes in suitable number also can be done. These are, so Sveda Karma, as Purva Karma, Vamana, minimum target dosha kapha, Virechana 3 days, target dosha pitta, and Vasti Sthanika, Nasya Sthanika, and Siddhavetha Sthanika, common target in all Vata. As Purva Karma, these can be done. Sneha Sveda can be done. And considerations as Pradhana Karma, Guna Vikalpa, disease, patient, place, season, these are the things we have to take into account. Pradhana Karma. So Guna Vikalpa, Rucha Snigdha, Snigdha, Kabhagna or Vadagna, Vata Kabhagna, this we have to think about. Whether the patient has Rucha more, we have to advocate Snigdha. When Rucha Snigdha is there, accordingly, we have to change the procedure. So Guna Vikalpa should be taken Kabhagna, Snigdha or Kabhagna, Vadagna or Vata Kabhagna. Which medicines should be given according to the condition of the patient, we have to fix it. So when it is Rucha, Baluga Sveda, Rucha Sveda can be advocated, Baluga Sveda, Churna Pinda, Adikiri, Kadikiri can be done, they are Ruchas, and Rucha Snigdha are Churna Pinda with Taila, Patra Bodala, Jambira Pinda are Rucha Snigdha, and Snigdha is Churna Pinda with Taila, etc. Anda, it is also Snigdha, Shashtikashali is Snigdha, and Goduma also is Snigdha. So we have to, in the depending upon the condition of the patient, you can change. Churna Pinda is Rukshada, depends on materials used and method of application. So Yava, Kola, Kulaptha, Kotanchukadi, they are Churna Pinda Svedas. It can be advocated in this condition of Vata Kapha or Kapha conditions. So, Kolabulathadi and Unakattavide, these things can be advocated. Nutrada depends upon materials used and method of application. That's what you have to find out. Patra Bodala, it is the Nirgundi Patra, Erenda Taila, Methiga, Sarshaba, Lavana, these are utilized. And Chincha Patra, Nalikera, these can be made into poultice and applied. Vatahara Patra, Vatahara Taila, Nalikera, Jambira, Methiga, Sarshaba, Lavana, Shatapushpa can be advocated. And even Jambira Phala, Haridra, Vatahara Taila, Methiga, Sarshaba, and Lavana, and Shatapushpa also can be made into poultice, and Patrapodala, Pinda Sweda can be advocated. Use of Drava in Sweda, Dhanyamla, it can be advocated in the conditions of Vata Kapha. It is Kaphatna, Dhanyamla, and Taila or Kurambu. Taila can be done, or Yamaka Sneha is called Kurambu, and Chira or Mamsarasa can be advocated if there is Pitta Anubantha in Vata, Daha, etc. The Chira, Mamsarasa can be used. Kaya Segam, Sambahana, Upayoga, Sambahana can be done, Upayoga with a Dravya Vigalpa, Mukkut, that is Trivsneha, Shitoshna Vigalpa, Midoshna or Sarvang, Swanga Shitala, Anga Shitala can be advocated. That depends upon Dosha Dushti in the person. So if it is too much Vadiga, Vadaka Bhaja, the heat may be somewhat, we can increase the heat. But in the conditions of Pitta, that much hot need not be there in the application. So Vamana, also Klesha Ahara before Vamana, Kapakara, Vyathi Padita, Vamana Satmya, and Abhishyanti. That depends upon the condition of the patient. Vyathi Parida and Vamana Satmya. Those who are Vamana Satmya, we can give Vamana. And Abhishyan, the Ahara should be given before Vamana. That we can divide according to some of the cases. We can have Idali, some of the which contains Masha, it gives Uklesa, and Payasa can be given, or milk, Masha cooked with milk, or curd, fish curry, Paya with ghee or curd rice also can. That depends upon somebody who is vegetarian, he cannot be give fish curry, he will not take. So it depends upon the person and his satya or shila. Utklesana ahara according to quality. Drava bhuishta, drava praya, peshala, akathina, masha preparations can be there. Snigdha, milk can be given. And Abhishyandakara, curd fish can be given. Sujaram, paya with ghee. With paya, ghee can be given. It is easy to digest also. Utklesana ahara according to qualities. So lakshanas to assess Utklesha is the heaviness of head, post-nasal dripping, congestion in the throat, congestion in the chest, puffiness of the face, and change in quality of sound. So from these signs and symptoms, we can find out that Klesha has been occurred. And from Prasega, Alasya, Nidra, and Mathurasya also are there. So by these conditions, Prasega, Alasya, Nidra, Mathurasya, we can find out who Klesha has occurred. So selecting Dravadravya in Akanthavana according to the Yogi Prakriti, we can fix Vada Vittahara Ikshu, Kshira, Mamsarasa, etc. and Vata Kapahara, Takara, Yusha, Badya, and Tushodaya. So accordingly, we have to fix according to dosha, Dravadravya taken for Akantapana differs. So Akantapana, if there is not enough Utklesha, Kapakara, if there is not enough Utklesha, Kapakara, it is better to give Akantapana to avoid complications. So better to give Akantapana only to avoid complications. So some of the cases we can give Chira, some of cases we can give Ichurasa. These are the things generally we use. So dose of Vamagadribya finalized after considering Posta assessment of the on the day of Pamana before administration of the medicine. Murdu finalized after considering Posta assessment on the day of Pamana. At that day, we have to assess. We cannot prefix it before administration of the medicine. So Murdu or Madhya or Plura Posta, accordingly, we can fix medicine. Mrudu, the Mrudu Kosta, Virejana occurs easily. So, and Plura Kosta, Virejana or Vamana, it is difficult also. So according to that, we have more medicine, moderate medicine or less medicines we can give. Okay. So those factors decide what Shuddhi required. Assess Kosta, assess Agni, assess Rogivela, assess Prakriti, assess the season. So according to the decide Shuddhi which is required. If it is preventive or curative, that also we have to take it to account while we think about the dose. If it is Mrudu Shuddhi or Madhyama Shuddhi or Pravara Shuddhi or Avara Shuddhi, we have to fix according to the dose. Avara Shuddhi, less dose can be given. Madhya Shuddhi, middle, and Pravara Shuddhi, if it is needed, we have to give more medicine. So in Vamanopagadravya, Eshtimadhu Fanta, commonly we are using, and Lavanodaka also, Kanadhatyadi Yoga also we are using. If it is Kapha too much, in that conditions, Kanadhatyadi Yoga or Lavanodaka can be advocated. If it is Pitta Samsarga, St. Madhupanda is good. In between, to trigger impulse to achieve complete Vega rather than Upavega. The Gananath Kasture has told about yoga, that is Vamana Kalka yoga, that is Akantham. After Akantapana of milk, we have to seek the powders of Madanaphala 6 grams and 4 grams of vacha powder and 2 grams of Sainthabalavana and mix with the honey and give it. Then in between we have to give this when proper Vamana. For getting proper Vamana, we have to give in between this St. Madhu Fanda frequently, so that Vamana occurs easily and also with Samyak Lakshana we can see in the cases. This is very simple and it can be advocated in the healthy person also as a preventive Vamana. This is very useful and we used to do it also. So accordingly, Panchakarma of most utility and popularity in clinical practice. The Virejana is most popular and Nija, it is easy to advocate also. Nija or Aganturoga, sprain, low backache and spondylotic low backache. Virejana can be Vada, Pitta Kapha, Pakshaghata, Tamila, Udara, there are indications of Virejana. In Pakshaghata, we say Pakshaghati Virejana. Virejana is indicated in Pakshaghata. And for Vata Roga, Murdu Virejana is indicated, while in Pitta, it is Tishna Virejana. So, Murdu Virejana does the anulomana of the Vata. And when we give Tishna Virejana in Vata, Vata Roga, Vata increases. So Mridu Virechana is done in Panchakarma so that Vata Anulomana occurs. And Vata Pitta, the Vata Pitta Anulomana also it does. Virechana is Sreshta for Pitta also. So Vata Vaitika conditions and Vata conditions, Virechana can be given according to the disease of the patient. And Kamila also, there are difference of Pandu and Kamala. In Kamala, he says, Murdubis Tikta Samyuktai Kamaliru Virejani. Murdu and Tikta Samyukta Dravyas Virejana should be given in Kamala. While in Pandu, Titra Virejana can be given. This is the difference of Pandu and Kamala. Because in Kamala, there is a disorder which occurs for the organ. Liver or yagrat gets diseased in the condition of Kamala. So Titra Virejana will produce the Chata of Kamala, or disease of yagrat. So we should be very cautious, and that is why Acharya tells Murdubhi Tikta Samyuktaihi Kamalidu Virejani. In Kamala, Murdu and Tikta Samyukta Virejana should be given. So we have to see even Virejana should be done according to the dosha condition and disease condition. While in Udara, the Titra Virejana is advocated, and Nitya Virejana also, because there is a Sanchaya of Jala. So in such conditions, if we want to purify it, Gomutra is given as Virejana in the conditions of, and Gomutra Haridagi. I had experience of Gomutra Haridagi given in several conditions of Udara, and it gives very good result. In ascites conditions, we can get good result with Gomutra Haridagi. 20 grams of Gomutra Haridagi is given in the early morning with a liquid diet, that is Kshira only he takes. So in such conditions, the Udara Roga gets a very good result. So we have to see even Virejana, different conditions and different diseases. There is Atura Bala Pariksha also should be done. That is Uttama, Madhya and Alpa. Daruna, Madhyama, Mrudhi Kriya, or Sthula, Krisha or Madhya. Karshana, Brahmana, Rukshana. These. So in Sthula we can do Karshana, Krisha we can do Brahmana, in Madhya Rakshana should be done. Uttama, Bala, Daruna, and Madhyama, and Alpa, Mrudhi Kriya. These we have to do. So selection of patients for respective karma as per Virejana Arihada. Virejana, Krisha, Sthula, Durbalendriya, Vasti, Mrudu, Virejana, Bala, Vritha. Vritha Bala, in conditions of, according to Bala, if it is too much, we can do Isha Virejana. If Bala is less, we can do Murdu Virejana. So even if it is Krisha or Sthula, Durbalendriya, accordingly we have to fix the medicine. So Adura Bala Pariksha is also important. If mandatory, then adapting the specific vidhana. Selection of Aushadha and posology, Bhedaniya, Annapana, and in Durbala, and Murdu Virejana in Alpamatra in Durbala. Durbala should be given only Murdu Virejana, and it is in Alpamatra also. Modification of protocol, Vasti Purva Virejana in Vyayama Shila, and Adura Dosha Bala Pariksha. See, Bahwanila Vastipurva Vilejana is given. And Vrittha Pratiloma Ayoga. And Mandakapha Samyak Yoga. And Bahubita Mridu Upaga Dribya. Then Sniktha Ducha Sarvan Sneha Videgi is to Rucha is to Sneha Bhavida. Sarvan Sneha Videgi is to Sniktha and Ducha can be given according to the condition. Sarvan Sneha Videga. We can give Sneha Videga in other. Rucha is to Sneha Bhavida. When Rucha person, Sneha Bhavita Autada can be given. Nadi Sniktha Sharidaya Dadya Sneha Videga. When there is too much Sniktha in the body, Sneha Virejana cannot be given. We have to give Rucha Virejana. Snehobhakishta Shariraya Rucham Dadyat Virejana. So Virejana also depends upon the condition. So Virejana in the Pitta conditions, we can give Avipatti and Gandharva Hastadi also Tribhurtlehyam according to conditions where Pitta is there, Tribhurtleha is good, Manibhadra Gula is there, Air and Taila, Mishra Sneha, when too much constipated patient is there, or in such conditions, Rucha Koshtha is there, and Krura Koshtha. In such condition, Mishra Sneha is very good remedy for them. And we have seen in many of the cases where Snehabana is done, and when Mishra Sneha, before Snehabana, when we do give Mishra Sneha in too much dose, he will not be getting Virejana. While Snehabana, after 7 days of Snehabana, when small dose of Mishra Sneha itself will give proper evacuation of the bowels. Why? Because by Snehana Karma, Samyak Snehana, almost all the channels will be Sniktha and the proper evacuation will be taking place. So, for Dipana Bhajana, Indupaganam is very good. Padola Muladi in Sniktha, when there is a Sniktha condition in the body, Ruksha Virejana, Padola Muladi can be given. Abhyadi Modagam, Vilangadanduladi and Kadugi also can be given. And these are Ruksha and other things are Avipatti, etc. Sniktha Virejana. And special care in administration, Kala, Shreshma Kali Gati Nyakwa Koshtam Samyak Viresi. Virejana should be given after Shreshma Kala. Shreshma Kala comes up to 9 o'clock, etc. After the rise of sun, 3 hours. So Virejana should be given in not in the early morning, but in the Pitta Kala only. So it may be given in 9 o'clock, etc. according to Adide Shleshma Kale. In such conditions, Adide Shleshma Kale, Kapha Kala should be finished. After that only, Pitta Kala only Virejana is given. Jirne ne Vamanam Yojam, Kaphe Jirne Virejana. Kaphe Jirne Virejanam. Vigata Shleshma Thagum. In such conditions, Kala also is very much important. Time of sunrise, 3 hours after sunrise will be the ideal time. Pitta Kala will be just starting. Rasa Avashesha Lakshana will not be there. Rasa Avashesha Lakshana will not be there. So, depends on season, region, and sleep habit of the patient. So, Vasti Karma, low back Vaidarana, obesity Lekhana, osteoporosis Kshiravasti is given, and it is told in the basic Sutrasthana itself, Tikta Grida and Tikta Kshira are used in the cases of Asti Kshaya. So Kshiravasti is very much important in the conditions of osteoporosis with the Tikta Samyukta. Tikta Samyukta Kshira, Tikta Samyukta Grida should be given for Vasti. there are some issues also. Isn't this merely focused on medicinal indications? No. Unlike oral medication, Basti as a karma has more potent interference. Even we say the mucosa, mucosal membrane of the mucosa of the costa certainly has a very good absorption of medicine. And this absorption is increased by the adding of in Kashayavasti, we are adding lavana and also honey, etc. These are salt, etc. Purifies the sources and it gets very good absorption. Even in modern, there is some of the painkillers are given through anal route without injection. This becomes very good, becomes a very good remedy. Suppositories are given after the delivery of the some women having pain after delivery due to the surgery, etc. Painkillers cannot be given through oral route. So what the modern physicians will advocate is suppositories are like Janac, etc. Suppositories are given and it gives sudden pain relieving effect. So not only in Ayurveda, even in the modern medicine, there is they have found out that this mucosa, the anal root, absorbs the medicines and gives very good effect. And when we are taking the medicine through the oral route, it creates some acidity problems, etc. For the painkillers, etc. While in this anal route, it doesn't make such complications. So they have also that science behind or application through the anal route they are doing. So isn't it necessary to apply Vasti to obtain optimum benefit? If so, how to do that in the safest mode? Okay. Samicha Vasti Prayuto Diyatam Gunai. Incorporating a multifactorial approach in Vasti Karma is essential. So, cause, nature of disease, purpose, Vajigarana, Vektabita, accordingly, Mathu, Gada, Kshira can be given, Kaphavata, Tila, Kaila, Gomutra, Aranala, Lavana, etc. And Chidajada, Katina, Balavan, Vyati, Tichna Avapa can be given, and Vibhariya, Mritu Avapa can be given. So it depends upon special care in administration, screen the patient before advising Vasti, as per indication, CI, and decide the feasibility of Vasti with special reference to the patient. Take care in and give due consideration to selection of the medicines and its dose. Check the instrument and ensure its efficiency. Fix the time of performance of Vasti with special reference to season, region, etc. Allow the patient to be comfortable throughout the procedure without compromising the SOP. Repeat steps if the procedure is interrupted by natural urges. So give due consideration to patients' physical and mental strength before fixing the course of Vasti. Take utmost care in emptying the Vasti bag. Never advise prolonged continuous course of the Sneha or Kashaya Vasti alone. So, one case presentation, 59-year-old male, chronic strange maturation, retention of urine since 12 years, associated complaints of lower abdominal distension, pain, low backache, difficulty in breathing, And history 12 years back, patient noticed retention of urine when the urge is felt and urine is excreted very slowly. 3 to 4 years condition aggravated, BPH, urogenic bladder with a significant post-voidal urine. Took both modern medicine and since then urine was removed by catheter. History of associated complaints, MRI, lower lumbar spine, D10, and hemangioma, L3, L4, L4, L5, IVD, bulge, and facetal joint hypertrophy, COPD, coronary arteries, concentric LVH, left ventricular systolic dysfunction, diabetes mellitus, and STN, hypertension. Chikitsa Paddhati, Adhirabala, Doshabala, Pachana, Anulomana, Pakwashya, Shodhana, and Bribhana, Shamana, Abhyandara, and Sthaniga. So he was Madhyama Bala and Doshabala Uttama, Abhyandara, and Abhyandara by Anulomana, and Pakwashya, Shodhana, and Bribhana. Bastikarma is indicated, and the best thing is Abhagam, Bastikarma. Chikitsa Paddhati, Kalavasti, Kriyakrama, and Aushadha, Dhanyandaram Taila, Vivagam for 2 days, Vaitaranavasti for 3 days, Dhanyandaram Taila with Vivagam for 6 days, then Vaitaranavasti, Shira, Balamula, Brihatyadigana for 3 days, Dhanyandaram Taila, Vivagam for 2 days, and observations, Kala after Kalavasti, even the variation, no variation noticed in BP, retention of Shira, Vaitarana more 4 minutes in comparison with Dhanyamla Vaitarana in 1 minute, urinary retention slight improvement, discontinued modern medicine, occasional urinary incontinence during night hours. So he got a very good improvement in the condition. Second case, 65-year-old female housewife, pain in both knees since 5 years, associated with pain in right shoulder. And history 5 years back, pain started in the right knee while climbing down the stairs. Later, swelling developed, took both modern and Ayurveda medicines and got some relief. A few months back, pain relapsed along with the pain in the left knee. So inspection, right knee mild to moderate swelling and right knee varus deformity and palpation. There was crepitus in right knee, there was extension flexion, very painful. Chikitsa Paddhati, Adhirabala, Madhyama, Doshabala, Madhyama, Kapha, Medohara, Rukshana, Lakhana, Brahmana, and Vastikarma was advocated. Shamana, Sthaniga, Upanaha, and Lepana, and Abhyandara, Snehana. So Kriyakrama and Aushadha, Kalavasti was advocated. Pipalya the Anvasana Taila for 2 days, Erandamula Niruha for 3 days, Tilataila 90 ml for 8 days, Chiravasti for 3 days, and Panchatiktang Chira, Kwatha, Gulgiritang Kashaya with Mathu, etc. And observations, event evaluation, occasional gastritis, body weight reduced to 74 kilos, and relief in pain, no medicines except external applications since the last 6 months. That he got a very good relief. And next one is Nasya, posology. Those in Nasya, basic unit is Bindu. That 1 Bindu means it becomes 0.5 ml. According to it, derived by collecting that which falls from the index finger, which has dipped into liquid container up to the level of 2 dip. And those in Nasya, basic unit is Bindu, 1 Bindu, quantity of liquid derived by collecting, which falls in the index finger. It depends upon the body index, specific dose pattern, and 1 Bindu, 0.5 ml approximately, 1 ml for each nostril, does not expel phlegm much, nor comes out orally on spitting. Kapha, Vada, Kapha, Dosha dominance, purificatory. Pitta, Vada, Pitta dominance, pacificatory. Kapha, Vata, Vata Kapha, purificatory types of Nasya. And Pitta and Vata Pitta, pacificatory Nasya should be given. Vata dominance, nourishing, Brahmana should be given. So these are conditions we have to think about. Clear cervical spondylosis, evaluate dosha gopa, bala, rutu, consider need of Svedana, monitor dosha chaya, shift to Brahmana or Samana or Tarpasthadi or Dhanyundaram Avarti, locomotor shoulder presentations, evaluate dosha gopa, bala, rutu, rule out history of corticoid injections, and consider need for Svedana or Lebana, monitor doshachaya, shift to Brahmana and Shamana, chronic sinusitis, migraine, etc. This is very effective. We have seen many cases that Masya relieves migraine and with Varanadi Kashaya internally and Masya with Chirabala or Anutaila. Certainly the sinusitis or migraine gets reduced. Evaluate dosha goba bala chronicity rudu, screen for exacerbations of acute fixes with history of hemolysis, consider need for pajana or talam, monitor doshakshaya, swarasa or anudaila sirovirechana daila. Clinical advanced neurological diseases, clinical application can be very nicely we can predict. Prathamana Tikshanasya has a breakthrough treatment, stimulatory action it has got, and Raktamoksha, different techniques of Raktamoksha are done. Baladosha Pramana Bhavshuthya Injirasija, Vitram Savayal Jandor Ashayam Samichaja. According to condition, we can advocate Siravetha, Pachana, Jaloga, Alapu, Shinga, or Hadi. Also, we can use. I am not going deep into that. These conditions. When Siddhavetha, when doshas are too much in the body, in the recta, we have to use Siddhavetha. When in Ekadesha, Pindida, Prachana can be done. If it is Grathita, Avagaha, Pitta, etc., Jaluga can be done. In Kapha, Sutta, Tukstha, we have to do Alabu, and Shringa can be done in Sutta, Tuksthita, and Sutta, Tuksida also Khadi. And Adura, Ashu, Asugumara, Sugumara, the Raktamoksha cannot be done. While Jalauga, Parama Sugumara. Even for Sugumara, Jaloga can be done. And Shamana, Deepana, Pachana, Rukshana, reasoning should be done. Selection of medicine should be done. Duration should be, and expected outcome also we have to do, we have to have. And Shodhana, selection of karma, reasoning should be there. And Vidhana, Shitoshna, Drishti, Parihara, and Purvakarma, Pradhana Karma, Mridu or Mathya or Tichna, Paschat Karma should be first decided. And Anantara Karma Vichara also should be done. Snehana, Brahmana, Rasayana, whichever may be. And Pathyavatya Nirdesha should be done. We say Shnoda Gopachari, Syad Brahmachari, Chapashya, Nivegaroti, Vyayama, Krodha, Shogahi, Madhavan, Pravadayane, Yana, Tvashya, Tyasana Samsidi, Nija, Titchavo, Bhutana, Swapnadhuma, Yajamsija, Yanyahani, Pibetani, Tavandya, Nyanya Vichedi. These things should be advocated. Always he should take Ushnodaga. Warm water should be taken, like that. Too much exercise should be avoided. And these are the Patyacharana we should advocate. Vishajam Sadhu Vrittanam, Bhadram Agamashalinam, Abhyasta Karmanam Bhadram Bhadravilashinam. So let me conclude. We have to always go through the basics of the Anjarma, and it should be advocated, it should be made into practical, then we will get 100% result in the Panchakarma procedures. Thank you. Thank you very much.
Thank you,
Okay.
sir. Thank you, sir,
Yeah.
for the valuable session in related to basic principles in Panchakarma. You are beautifully mentioned the yukti in selecting each karma. Thank you, sir, for the session. So now we are moving on to the discussion part. Sir, we have some questions in the chat box. Can I ask?
Okay. Chat box. Okay.
Okay. Sir, there is a question. Can you please elaborate on relevance of Shirovasti before Nasya? Can you please elaborate?
Yeah. Okay. See, Shirovasti before Nasya. Shirovasti is a procedure which is conducted as a Snehasveda procedure. So purification is needed after the Vasti. And the purification which can be done for the Shiras is Nasya only. Shirovasti is a Snehasveda procedure, preoperative procedure in the prior to the Shodhana Karma. Not only that, Shirovasti can be done after purification also as a Tarpana. That is the criteria or theoretical background on which we are treating the case. If we need purification before, we can have Nasya first, and as a Tarpana Krama, we can have Shirovasti. As a Sandarpana Krama, we can, with medicines, we can have a Tarpana. Otherwise, if we are doing Shirovasti as a prior procedure before Shodhana, we can utilize it, and after that Shirovasti, we can have Nasya.
Okay, thank you, sir. There is another doubt related to the Gandharvastadi. How much quantity is required for Virejana? Gandharvastadi Kashaya, how much quantity we need for Virejana?
Yeah. Gandharvastadi Kashaya, Gandharva Hasta Chiruvilla Hudasha Vishwa Pathya Punarnava Yamashaka Bhumitali Vathas Sasaindhavagula Pavanasya Shanti Vanherbalaya Rudaye Malashodhanaya. It gives Malashodhana. It's a day. If we take the Gandharva Astadi as the prescribed 60 ml, we will get a minimum quantity of Virejana. It's a laxative purpose, it will say, not a drastic purgative. So if we want more Virejana, in such conditions where there is Rukshada of the Koshta or Krura Koshta, Gandharvasta Kashaya will not be effective. We have to give Gandharvastadi Eranda Taila, mix it with Gandharvastadi Kashaya and advocate, then he will get very good Virejana. The dose may be, Kashaya dose may be 60 ml, and Taila Gandharvastadi, our this castor oil when we are giving, it may be 1 to 2 teaspoons. That's all.
Okay, thank you, sir. There are some other questions which all are related to the disease-wise Panchakarma. So there we are having an upcoming session related to the disease-wise Panchakarma. So will be discussed there.
What?
No, sir. There are some other questions
Yeah.
related to disease-wise Panchakarma.
That we will be having another session, you know.
Yes, sir. Yes, sir. We will be having another session.
Yeah.
So we will be discussed there. Thank you, sir. So thank you, sir. Then move on to the other part. I invite Dr. Jasul for briefing of the session.
Thank you, sir, for giving such a nice introduction to Panchakarma. So we just started only all these things because it's only a small part. We need to go further and we need to go deeper and get deeper insight in all these principles to get apt to select the apt Panchakarma treatments in every diseases. So in coming sessions, we'll be dealing all these things and more basic principles. Thank you, sir, for a nice introduction. And we can have these further discussions later also, as due to time restrictions. We can conclude this session right now. Okay, we'll be dealing all these things in deeper in other class in next class also. Okay, thank you. Over to you, Dr. Rashmi.
Okay, doctor. Let us wind up today's session.
Okay.
Yes.
Okay, see you. Good night.
Okay.
Yeah.
Thank you, sir. Thank you all the
Thank you for
participants.
coming.
Thank
And,
you for patient hearing for all the scholars. Thank you very much. We will meet you again. Okay.
Yes.
Thank you.
Okay. Thank you.
Okay.